Why don't we go ahead and get started? I'd like to welcome all of you today. Aloha and welcome to Palolo Chinese Home's first community educational webinar, where we work to support our seniors in changing times with the help of some amazing speakers today and some information on resources. I'm Darlene Nakayama. I am the CEO of the Palolo Chinese Home. And today we are honored to be navigating the new normal with our special guests, Dr. Yazawa and Mia Taylor. Thank you both so much for joining us today. We have received some great questions in advance from the audience, and we will also be opening up a Q&A session to cover more a little later in the program. You'll see here that you can submit your questions during the session by typing them in the Q&A box on your screen. While we may not be able to answer all of your questions, we will hope to be getting them answered for you, and it'll be posted on our website. We will also be recording today's Zoom session and sharing it on our website also. So please note, only our speakers will be visible during the discussion. So why don't we go ahead and get started? Dr. Yazawa, can you share a little insights into your work and how that's informed some of us of what we'll be sharing here today? Dr. Yazawa.
Yes, thank you, Darlene. Thank you for this invitation. I'm happy to be here. I'm a geriatrician over at Straub Medical Center, Hawaii Pacific Health, and I primarily work in nursing homes in the post-acute and long-term care setting with a number of other physicians and nurse practitioners. I'm currently with HI-EMA as the long-term care lead for the COVID response, and working again with nursing homes, assisted living, care homes, and foster homes.
Mahalo, Dr. Yazawa. Mia, can you also share your background with us and perhaps some of the things you've noted in your work in community services that particularly resonates with this discussion today?
Thank you, Darlene. Yes, my name is Mia Taylor. I am a family nurse practitioner, have been a nurse for over 35 years in a variety of different settings. In the past 7 years since I've been here on Hawaii Island, I have been working both in community hospice palliative care as well as at Queens, developing clinical programs to help support the most vulnerable, high-risk, high-needs patients in the community. We have at the Queens Clinically Integrated Physician Network groups of nurses, social workers, community health workers, pharmacists and dietitians that go into the patient's homes or support patients telephonically. And then most recently, I've been working closely as Director of Community and Post-Acute Care Services. I've been working closely with our community partners to really help meet the needs of the patients and the providers in a full continuum of care. So I'm very excited to be here today to talk to you more about what it's like to really manage patients in this era of a COVID pandemic.
Thank you, Mia. So why don't we go ahead and get started? Dr. Yazawa, with this being a novel virus and a new frontier for us all to navigate together, there's a lot of fundamental confusion around the virus. How can seniors stay healthy and avoid exposure to COVID-19 in the community? Can you help us go through some of the essentials?
Sure, yes. Those are all good questions, and I'll try to go over sort of prevention and a little bit about the virus and what we can do, and especially what makes the geriatric population especially vulnerable to this virus. Next slide. So as many of you know, how do we get or contract COVID-19? Close contact, and we define close contact as being spending 15 minutes with someone within 6 feet of each other. Obviously with no protection would be considered close contact. Most commonly we know about sneezing and coughing, or even just loud talking, singing, those kind of things have been proven to contribute to spread. And then there's some evidence as well that touching various surfaces where the virus may have been on and then touching our nose and face and eyes can also lead to spread. Next slide. So what can we do to prevent this? And I'm sure by now, how long has it been since 6 months or more now into this pandemic? We've heard over all sorts of resources in the news and what kind of things we can do. And I'll just go over that next slide. So obviously, just daily, things like hand washing, wearing a mask. If you do have someone in the home that may be ill or exhibits any cold-like symptoms, keeping them separated in a separate room, monitoring your health, taking their temperature, taking your temperature, keeping surfaces disinfected, the bathroom perhaps that they use, and then taking care of yourself as well. So these are kind of basic infection control measures that we take even when someone catches a flu, or we should be anyway, to try to prevent spread within the household. Next slide. So again, protection tips, maintain social distancing, at least 6 feet. I think 6 feet sort of the magic number, but there's depending on wind conditions and other types of conditions, blowing of AC fans, that number could be larger or smaller. Wash your hands frequently with soap and water or alcohol, with at least 60% alcohol can help disinfect the hands as well. Keeping objects in high touch areas clean. So things that like light switches, places where people are constantly touching, important to try to keep that clean. And then of course, avoiding touching the eyes, nose and mouth. Next slide. Okay, so this is something interesting. How long does a virus live on different types of surfaces? And as you can see, the non-porous type of surfaces like steel or plastic, the virus tends to stick around a lot longer. Things that are a little bit more porous like clothing or paper, cardboard, those kind of things, you can see that it doesn't last as long. Just so you're aware, some of the hard surfaces should be cleaned more thoroughly. Okay, next slide. Again, just washing hands. Soap and water does fine just as well, or better maybe, but something that has at least 60% alcohol is what the CDC currently recommends. Making sure you get the fingertips, under the nails, all those areas, not just a quick wash. As you can see, 20 seconds, singing happy birthday twice would be a good way to measure if you're washing your hands adequately. So the challenges for our geriatric community are many, because as we know, our kupuna are definitely most at risk. And in my work, any congregate living settings like nursing homes and assisted living, where we have a lot of older folks with chronic illnesses or chronic diseases, is quite a challenge. Next slide. Our kupuna often have weaker immune systems. Again, I mentioned that they have chronic underlying medical conditions, could be heart disease or diabetes, often living in congregate living conditions or multi-generational living households makes this a challenge. And really the person that brings the virus in to our kupuna, who generally are not the ones getting infected going outside, but it's really the family members or staff of a nursing home. They are what I call the Trojan horse. They're sort of the back door in which the virus gets into our communities where the kupuna live. And often many of these folks are asymptomatic or pre-symptomatic. So the person carrying the virus may look and feel fine, but could be infectious. And that's what makes this a very difficult situation. And then to isolate our seniors, I mean, I understand that that's the recommendations, but the emotional and impact of social isolation are real. Next slide. Okay, so I just kind of went over briefly some of the challenges that we have with our geriatric population. I know that Mia is going to talk a little bit more about some of the resources out there. Did you have some questions for me, Darlene?
Dr. Yazawa, that has been such great information for all of us. We've also had some questions come in regarding masks and PPE, such as just how much does a mask really help? Is there recommended PPE to use, and are there tips on how to properly wear a mask? Can you share some insights for us?
Great questions, great questions. I think by now everybody should know that the mask is very, very important. Even having a cloth mask, there's a lot of good evidence and studies that show reduction in spreading the virus and reduction in actually getting the virus from someone near you. I think the combination of mask wearing and social distancing are critical. I mean, they're not 100%. People talk about the N95 mask being a very good mask. It does require fit testing, so it's not for everyone. I mean, you can buy it and wear it. I'm sure it'll be helpful, better than nothing. But you know, if you're not properly fit tested, it is not an absolute answer. So anything from a surgical mask or a cloth mask, a face shield, those kind of things, and combined with social distancing are definitely critical until we get a vaccine.
Thank you, Dr. Yazawa. I think you kind of touched on the next topic, Mia. There is also such an emotional component for us to navigate together during this pandemic. Our audience is wondering about how to keep our seniors' minds engaged in a period of so much isolation. And they're looking for ideas on how to keep our kupuna connected, both with and without technology. Even key basics like getting their essentials, food and medicine, can feel challenging and scary in these times. Can you walk us through some further ways to support our kupuna?
Yes, thank you, Darlene. I think that, you know, for all of us that have been involved with our kupuna during this pandemic, we have seen some incredible changes in their routine, and we've really had to step up our game in meeting the needs of our kupuna. So I'm going to share with you some slides. We're going to go through some historical information and then some ideas moving forward. Okay, so next slide. All right. We'll also be, I think, talking a little bit about some of the resources that we have at the end of the slide deck. But just to give you an idea, what we did is we broke down the resources to include housing, utility, food, and transportation resources that are local resources here in our community that all of you on the line will be able to access. We put links to the websites. If we have time today, we'll go over some of those, but otherwise we'll be sharing those resources. And I think, Darlene, those resources are going to be on the Palolo website as well, correct?
Yes.
Okay, great. Next slide. All right. So this actually is a study, if you can see on the bottom, this came from October of 2018, so well before the pandemic, where it was found that about 34% of our kupuna felt that they were feeling a lack of companionship and that there was a significant amount of loneliness. And so along with that, of course, comes now, on top of that, social distancing, the typical routine of just going to the grocery store, going to the community center, going to church on Sundays has really magnified that whole feeling of loneliness and isolation. Next slide. So one of the things that we have found is that this isolation, not being, or not feeling safe to go out into the community, even though, as Dr. Yazawa spoke about, using masks, social distancing, good hand washing, that's really a key as well. What we've pretty much been telling people and what our leadership and our government leaders have shared with us is that you really need to social distance. You need to stay at home. We've had several stay-at-home orders. And so what that also has done is it's impacted our patients' ability to see their providers, to go in for their routine follow-ups. Some of our patients are reluctant to go and get their blood work done. So what that has led to is a significant decrease in the preventative health strategies that we use and management strategies for chronic illnesses. Oftentimes it's lack of transportation. There's lots of different barriers and factors that feed into that. So it's really led to a significant public health and safety concern. Where we're seeing it in large numbers is our decrease in ED visits. So what has happened is ultimately patients may have symptoms that otherwise would lead them to be seen in the emergency room, and they're now staying at home saying, oh, it'll pass, it will go, I'll feel better tomorrow. And what we have seen ultimately is patients very critically ill having to call 911 and come into the emergency room. So what we've really tried to do is educate patients that they should still be communicating with their providers. That can be done telephonically, it can be done via telehealth, lots of different options there. But if you're not feeling well, please reach out and speak to your providers. So it's really, it's impacted multiple facets of our lives. Next slide. So I've talked a little bit about isolation, loneliness. I've talked about the physical health, the impact on physical health, but also the impact on mental health, specifically depression and anxiety. So we have seen a significant increase in anxiety-related visits and calls to providers. Family members have called and said, our KUPUNA they're not sleeping well, they're feeling very distraught, very isolated. And so we've really tried to proactively outreach our KUPUNA by making phone calls, really assessing what's going on with them. Are you having symptoms of insomnia or not being able to sleep, racing thoughts, fear? Those are all things that we really want to address early on. We have also seen, unfortunately, a significant increase in suicide ideation and suicide attempts. So we want to be mindful of mental health. We want to remind our older adults, but everyone, to think positively. It's so hard nowadays when we're listening to the news every day. We're listening to the numbers of COVID increase and the deaths related to COVID increase. It's very hard to focus on positive things, but we should really try every day to really think about what should we be thankful for, what is good in our day, what have we done today that's really been fun or relaxing. And if you can't think of anything, really encourage the family, encourage your loved ones to really work on a fun activity. It may be puzzles, it may be family games. I've had various families tell me, wow, we've started playing Yahtzee again, or backgammon, or Monopoly, right? Doing large puzzles. Some of those things that we really had put to the wayside because our lives are so busy and we're out and about. And so now we have that opportunity to kind of bring back some of those things that were fun for us as children as we were growing up with young families. Taking a walk down memory lane, reminiscing about happier times, talking about, you know, trips that you've taken, reviewing maybe photo albums or videos from prior trips. All of those things really help older adults cope with some of the stressors that we currently have. And then keeping news to a minimum. I don't know about you, but I can tell you there's been plenty of days where I've come home after a really stressful day and I just don't want to watch the news that particular day. I just really want to read a good book or do something fun and really put it aside for a little while. That's really important. It's important for us to rest our minds and really think about other things. So those are just some quick tips around depression and anxiety. Next slide. Reducing distress, boredom, and isolation. So, you know, we talked about the loneliness, we talked about the depression, the anxiety. Now I really want to talk about some things that you can do, easy things, in addition to what I mentioned on the prior slide, for our KUPUNA, for our elderly, but also for our children. This really applies to everyone. Avoid drastic changes to daily routines. Now, if your daily routine is going to the coffee shop with your friends, or your daily routine is going to the senior center to exercise, those things can still be accomplished via Zoom. You can have, in fact, we just had a group of students who set up a Zoom with some of the KUPUNA to have a tea, a virtual tea with some of their KUPUNA in the neighborhood. How fun is that, right? So those things can still be accomplished. It's just via a different route. You want to have predictable visits or calls from caregivers. So there's lots of different grassroots efforts in the community now where churches and community organizations, we did it here with our community navigators and social workers doing outreach calls to our KUPUNA and just having a quick conversation. And then making sure that you schedule the next call. Say, how about I call you again next week, Tuesday, so they have something to look forward to. So you want to really brighten their space as well. So plants, you know, just colorful. Some of our families were sending like the edible arrangements to some of the KUPUNA, really just adding some color and cheer to the home. Next slide. Helping seniors communicate with loved ones. This is really, really key, especially, you know, as Dr. Yazawa had mentioned, you know, we have many of our KUPUNA are in care homes, nursing homes, long-term care facilities, and they really have not been able to have visitors now for many, many months. So I'm just so grateful and impressed with what our community partners have come up with to keep their KUPUNA who are in these facilities connected. They've purchased iPads. They've used smartphones so that you know, the KUPUNA can FaceTime. Staff has gotten really creative with ways of, you know, bringing family members to the window and allowing them to communicate safely and but still be able to see their loved ones. And then really, you know, the lanai and yard visits, that is something that on the mainland they've been doing for quite a while, where they just, and I think, Darlene, I feel like I just saw recently at Palolo where you also have had that, where you've wheeled people out into the courtyard and had families come drive by or visit. Those are great ways to communicate. It's so important. Next slide. This is one that I really wanted to call out as a resource, a GRAMMI companion. And this is actually was a local individual who set this up. And this is where you can actually schedule a companion who can call on a routine basis and communicate with the KUPUNA. talk about interest, how their days are going, all of those things. And there's the phone number and the web link. So these are examples of, again, where our community partners have really stepped up to the plate to meet the needs of our KUPUNA during this pandemic. Next slide. So I think that these are some of the references and resources in the community that we are that we'll review later on in the conversation if we have time. But at this point, I want to pause because I think what we wanted to do now is go to some of the questions. I know quite a few questions have come in, and so Darlene, I'm going to turn it back over to you, and then we can talk about resources a little later.
Those were really wonderful insights and resources. This is also a great place in the discussion to introduce Isa Pobre. She's our Senior Daycare and Wellness Program Manager at Palolo Chinese Home. Palolo also has key resources to support our KUPUNAs during these times. Isa, can you walk us through a few?
Hello everyone, I hope you all are safe and healthy. Palolo Chinese Home is one of Hawaii's largest continuum of care provider. Next slide. From residential and campus-based program, which includes our skilled nursing and intermediate care, hospice care, rehab, adult residential care, overnight respite, and our senior daycare that is open 7 days a week, including holidays. Next slide. We also have our Palolo Wellness Program, which is our community base, which includes our meals to go, home cleaning, and our in-home personal or companionship services. If you have any question, you can visit our website at palolohome.org or give me a call at 748-4909. You can also email me at apobre@palolohome.org. Thank you.
Thanks, Isa. There are wonderful resources in the community for answers, support, and encouragement. And we'll be going through a few more momentarily. But first, let's open it up to some Q&A. We have some more great questions coming in, so keep sending your questions in. This is a great question, Dr. Yazawa. I think this is for you. If I have other health concerns, is it safe to go to the doctor for a checkup?
Yeah, great question, Darlene. You know, I think that we shouldn't put off our normal health concerns because we're afraid of COVID. I think a lot of doctors' offices are taking that into consideration by limiting the number of people in their waiting rooms, by having a little bit of a slower schedule. I think what we're seeing is a lot of folks avoiding the emergency room or seeing their doctor when they have alarm symptoms like chest pain, for example. And and so it's important for our KUPUNA to not to pay attention to those symptoms and continue to see their doctors. You know, and a lot of doctors are doing telemedicine type of visits, so they can do visits through the computer, and if they can get their son or daughter to help with some of the technology, you know, that's also possible, or even a phone call is still possible. So I would kind of hesitate to say avoiding your doctor. I think that's, you need to still continue to maintain your health. Hopefully your doctor's office is taking precautions for social distancing, wearing your mask to the doctor's office, you know, arriving right on time, not too early, so you're not hanging out in the waiting room too long, things like that. But for sure, I would definitely continue to see your doctor for checkups, and especially if you have any concerning symptoms.
Thank you for that answer, Dr. Yazawa. Okay, this question looks like it's for Mia. The question is, should seniors shop in the community?
Good question. So again, we're constantly preaching, physical distancing, social distancing, and even with mask and good hand washing, there's still risk. There's still risk involved. So we want to minimize exposure as much as possible. Having said that, it's really important that seniors are able to get their groceries, to get their, their household supplies. So there's lots of options there. Many of the grocery stores have KUPUNA hours, where early morning, usually from 7 to 8. It's for the geriatric population to be able to go into the stores. But there are other options, delivery. So some of the grocery stores, for example, that were previously charging for groceries to be delivered are now waiving the delivery charge for our KUPUNA. There are many organizations in the community that will actually help with food delivery. And one of the resources that we have listed is our Aloha United Way website, the 211. They have all of those resources. That's an easy way to call if you are elderly, or if you're someone who's at risk and you do not want to go into the grocery store. They have lists of individuals that will actually do grocery shopping for you and do the deliveries for you. So there's a lot of options out there. One thing I have to just share is that I see a lot of our KUPUNA, a lot of our just community, the community at large, going into the grocery stores and wearing gloves. So I think that everyone feels that those gloves are going to give them some added protection. I just want to caution that if you do wear gloves into the grocery store, it still is really key when you leave the grocery store to take those gloves off before you open up your car door and get in your car, because now you're contaminating the car just like you would if you didn't have gloves on. The key is good hand washing. So what I would recommend, rather even than gloves, or if you do gloves, take them off before you touch your car, and use hand sanitizer before you get into your car, before you get into your home, so that you're not transmitting those germs that you may have come in contact with in the grocery store into your car or your living situation. So.
Thank you, Maya. I think you touched on a really important point, both of you. That's the importance of hand washing. So thank you. I think that point is really important for everyone to note. Okay, moving on. I think this is for Dr. Yazawa. What can you tell us about testing? With the trans-Pacific travel opening up and all the different types of tests available, what testing processes will be utilized as trans-Pacific travel opens up?
Yeah, good question. There's a lot of different types of testing out there. You hear about the PCR testing, which is the one they sort of put a swab up your nose. That often takes as little as 8 hours, but pretty much 24 hours. Sometimes it takes longer. You've heard of some of these antigen testing, which is results in about 15 minutes, a little bit less accurate than the PCR testing. And then you're starting to hear in the news about some of the testing that you can do by just sort of spitting in a tube. So there's a lot of different testing strategies that are out there. I think one of the concerns we have for our state as we open up for travel is the capacity of testing. How many tests can we get, of what type, and whether our labs can handle it. Some testing obviously doesn't require a lab. Some testing is quick, but not as accurate, especially if you're asymptomatic. So if you don't have symptoms, the test may read negative and is a little bit more accurate if you actually have some kind of symptoms. I think the key is, if you do have any symptoms of what you think might be a cold or COVID, to go ahead and get tested right away. And I think what we'll see over the next few months are better ways to test, easier ways to test, faster ways to test, and cheaper ways to test. And so if what American ingenuity has done in these COVID times, it has figured out ways a variety of ways to test for us and make it more speedier and less or more comfortable, I think.
Oh, that's a complicated situation with testing. So hopefully it'll get clearer as time goes on and more testing will be available for all of us wanting to travel. So Mia, this is probably from a family member dealing with a senior with dementia. So would you do anything differently for seniors with dementia during these times?
Yeah, good question. So I think first and foremost is you want to try and keep their routine as much as possible. For those of you who are either struggling with dementia or are caregivers for individuals with dementia, what you probably have noticed is that they don't do well if their routine is changed. So even if they're not able to go to their daycare, their senior center, getting them up the same time of the day, having breakfast, lunch, and dinner at the same time, really having that interaction with them is really, really important. If they're not able to see their loved ones, for example, if they're in a long-term care facility and it's normal for their wife or their children to visit every day, making sure that you can have those visits occur with either an iPad or something that they can still see their loved ones, hear their loved ones is really, really important. The other thing is decreasing external stress and stimuli. So for example, patients with dementia, they are very sensitive to their environment and their surroundings. So if everyone else around them is talking about the pandemic, the deaths associated with it, how afraid everyone is, the individual who's suffering with dementia is going to really pick up on that, and they also are going to have significant increased distress. And they may not be able to process everything they're hearing. They may be able to process bits and pieces of it and not fully comprehend what's going on and really, really become very agitated during these times. So again, if you see that they're being agitated from watching the news, listening to the radio, turn it off. Turn it off, put some music on, try and really address that. Be very sensitive to how they respond to their environment.
Thank you, Mia. I just wanted to remind all of our attendees to please continue submitting your questions, and all you need to do is press the Q&A button at the bottom, and you're welcome to send us any kind of questions that you may have. And this question is for Isa. So Isa, the question is, in adult daycare, how does it work right now, especially with the pandemic, the COVID-19 and the risk of catching COVID-19? So the question is, how does adult daycare work at this time?
So our adult daycare is open. We are still open 7 days a week. We are constantly hand washing. All our participants are following the 6 feet social distancing. The families are not allowed to enter the facility. We do ask the families our COVID questions to make sure that, they're not surrounded by anybody who had COVID. We are doing our COVID screening, doing our temperature before they enter the facility, same as our staff. All the staff are required to wear their mask at all time, our shield. We are encouraging all participants to wear their mask too. And we are disinfecting all items and surface every 30 minutes before and after use. And, we are just constantly hand washing.
Thank you, Isa. Let's see. This question is for Dr. Yazawa. Dr. Yazawa, there's always talk about people with underlying conditions. So the question is, what are the underlying conditions that contribute to a higher death rate? What makes one high risk to getting really, really sick with COVID-19?
Right. Okay, so let me just talk about the regular person, not just our kupuna, but our, we are seeing even young people succumb to this disease. And generally speaking, they have some kind of underlying medical illness like diabetes, or we know that people who have compromised respiratory or lung function are easily get sicker with COVID. It also does affect our heart. So people who have had heart disease, who had a history of, say, heart attacks or heart failure are at risk. And then I think predominantly really obese folks and the younger folks have, it has been a risk. Now for kupuna, I think their immune systems are not as strong. They're very frail, meaning their ability to bounce back from a disease or an illness is somewhat compromised, which makes them definitely a higher risk for COVID.
Thank you. I guess this is for Mia, kind of along the lines of caring for kupunas at home. It says, the question is, I have to fight to keep my kupuna home. Please help with strategies so that it's not a struggle to have grandma or grandpa stay home.
Good question. Good question. So I think, again, for our active kupuna, who, I mean, their socialization, their exercise is usually done outside the home in conjunction with friends, family. So it's really, really hard when we all of a sudden tell them, no, you have to stay home, you have to stay home. So some of the suggestions that I have is that if they need to get out of the house, and I totally get it, especially living in Hawaii, it's beautiful to be outside, right? Try and offer lower risk options. So for example, if they typically go with their friends to the coffee shop and walk in the mall, how about just having them walk out in their yard or walk in the neighborhood outside, socially distanced? They could still do that with their friends if they wanted to, but do it socially distanced. Other thoughts around that, if it's really around exercise, there's some great references and resources that we have listed where there's YouTubes where they can go on to YouTube and they can do a 15-minute exercise. We also have several links where they can go on to Zoom with their friends and do either yoga, chair yoga, Tai Chi, a variety of different ways that they can still have that social connection, get their exercise in, but not be in a high-risk area. We really want to avoid restaurants, crowded areas, grocery stores, that it's really just all about minimizing the risk. But we recognize that they still need to be able to interact and get out of the house. So hopefully that helps.
So I'm going to go ahead and answer this next question. And the question is it safe to be in a care home or a nursing home? And Dr. Yazawa, please jump in. Feel free to jump in. In our nursing home and in our care home here at Palolo Chinese Home, and I know in the community in general, we are very regulated by the Department of Health, CMS, and the Centers for Disease Control. And what that includes is we have numerous checks and balances. For us here at Palolo, we do have to now screen our staff people every week. And I think because of the positivity rate and because of all of the good work that our community has done, because our testing frequency is based on the number of positivity rate in the community. So I'm hoping that within the next week or two that our testing will be going to monthly. So we test all of our staff people, we screen everyone that comes in, and I think Isa did a really great job in the interventions that we do on a day-to-day basis. We also have visitations through our Zoom and our cell phones and etc. And we are beginning to open up our visitations, and we're including outside visits. So that's coming. But the safety of our kupunas is very important to us. And so we want to make sure that we do take every safeguard to ensure their safety. Dr. Yazawa, do you have anything else you want to add to care homes and nursing homes and some of the challenges
that's a tough question. You know, I think everybody is trying their best to try to keep the virus out. And like you said, there's a lot of regulations out there to try to keep it out. There's a lot of testing being done of the staff to keep it out. I mean, unfortunately, you know, it's a congregate living situation, meaning, you know, there are many people all living in the same place, which by definition makes it a riskier place to be, for sure, rather than if you were just alone at home. So, I mean, there's no doubt that there is increased risk anytime you have a lot of people in one place. And like I said, the Trojan horse is really the staff, right? It's very rarely that the patient comes in with COVID, but it's a staff member that ends up becoming positive because that staff after work will go home to their families and they have family members who are out in the community and working in the community. So they're often the ones that bring it in. And that's why we're doing the testing, like you said, Darlene, weekly with the staff. So yeah, so that makes it tough. I think that there's still certainly some risk, and we do our best to try to keep it out as much as possible.
Thank you, Dr. Yazawa. You know, we have gotten some really great questions from all of you, our attendees. And if we weren't able to get to everyone's question, we'll certainly work to get to them and get them answered and onto our website. We do want to further share some key resources and numbers again on our Palolo Chinese Home website. But I think Mia has a few more resources and some information to share with all of us. Mia?
Sure. So I think we'll go to the slides, and I saw a couple questions as well around vegan options for food delivery, things like that. And there are resources out there. And again, I think that you know, what I have here on the slides are some specific resources, but kind of the clearinghouse for all of the community resources. I'm just going to steer everybody to the 211 Aloha United Way. They have done a wonderful job of just really collating all of the various resources. But as far as food resources go, there's the Hawaii Food Bank. And now this is, again, many of these resources are free. The other one that I want to mention here for food delivery is the Meals on Wheels. I think that there's a misconception in the community that in order to get Meals on Wheels, people have to be under a certain income. And that is true if you are getting the Meals on Wheels for free. But anyone over a certain age is eligible for Meals on Wheels delivery, and oftentimes they have low sodium options, they have specific, you know, dietary criteria. They have been an incredible resource to our Kupuna year-round, but especially during this pandemic as well. So lots of good resources there on food. And then I know that there have been various churches and organizations that have really focused on vegan options. And again, when any of my staff is looking for a specific option, if we don't have the resource, we do call 211 to find out what they have available. So, all right, so next slide is just a little bit more about the home delivered meals. The Elderly Affairs Division is another great resource. This again is a clearinghouse of a wide variety of community resources that are really geared towards our KUPUNA. And they're available year-round to help support our KUPUNA. They typically will actually go into the home and do one-on-one assessments. During this pandemic, they have kind of set aside the face-to-face assessment, but they are doing telephonic assessments. So great resources there. All right, next slide. The KUPUNA Needs Project. And this is really has been a great resource. So we talk a lot about food delivery, but this project also through Catholic Charities, they will deliver toiletries, cleaning supplies. They've delivered a variety of things for us. So just a great resource. Okay, next slide. Housing. Lots of concerns around people being able to make their rent, both for the KUPUNA, but also the caregivers who are caring for them. There's been a lot of questions and concerns around, you know, the waivers that are in place right now about eviction and things like that. So these are great resources to use if you have any questions, if you have landlords that are putting pressure on you about paying rent, things like that. These are some great resources in the next few slides. Okay, this is the, oh yeah, and then the resources for utilities as well. Aloha United Way is probably your best resource here to help with assistance. Hawaii Electric has also extended its suspension of services disconnection for non-payment through the end of the year. So again, these are all things that I think are great stressors to our KUPUNA and our caregivers in the community. And so we want to make sure that if you are at risk, don't wait until you have, you know, your 2 months in arrears. Call early and see what kind of help you can get, what kind of financial resources are out there. And here's just some more on utilities as well. So, okay, next slide. Transportation. This is a big one. So for our KUPUNA who were relying on the bus or possibly taking taxis, you know, we all agree that those are some relatively high-risk transportation options right now in the setting of COVID. There are definitely other options. So handy van is a great option if you're having to get to your doctor's appointments. The handy van companies have done just really an amazing job in keeping the handy van, the staff is all masked. They are, you know, having social distancing within the van. They're doing terminal cleaning in between patients. So they're really trying to step up their infection control practices. So it is a good option. A lot of other people will use Uber. Again, totally appropriate when you're using Uber to talk with your Uber driver about, you know, that you are at risk and you want to make sure that they're keeping you safe. You can have that conversation before you get in the vehicle. So I know we only have just a few minutes left. So let's see, we have the behavioral health resources, but then I think we're going to go back to just a couple more questions. But I wanted to at least talk about the behavioral health resources. For anyone that is dealing with anxiety, distress, depression, these are some great resources. The Hawaii Cares line is available. There's also the crisis line. calling your physician, calling your health provider, calling a friend. It's really important that you reach out. There's no shame in sharing that you're distressed. We're here and ready and able to help. We want to support you through this. So these are just some great resources. Next. All right, we'll turn it back over to you, Darlene.
Gee, where did the time go? We only have about 4 minutes left. So why don't we just take one more question? And I guess this is for Dr. Yazawa. The question is, what advice can you give to the community about people feeling shame about contracting the coronavirus? I hear this question a lot. So, Dr. Yazawa?
Yeah, boy, that's a tough question. You know, I think if you're a care home or a nursing home, I mean, obviously we want to be transparent. What we're trying to do is we're worried about the larger public community at large, and so it's important for our public health and our contact tracers and everyone to know where the virus has gone. So even if you're an individual and you feel that you may have contracted COVID, I mean, it's important for the contact tracers to try to figure out who else it was spread to. And they're pretty good about being as anonymous as possible. I read in the paper the other day how a lot of folks aren't returning phone calls to contact tracers or aren't being very cooperative for a variety of reasons, whether it's shame or being blamed. And I completely understand that. But what we're trying to do is contain this virus, and if everybody doesn't cooperate to help stop COVID, when tourists come and when we reopen our schools, we're really going to have a challenge in trying to contain that. And then what's going to happen is another shutdown, and then that doesn't help anybody. So it really is a community effort. I know that the Department of Health is really keeps information confidential. I mean, sometimes it's hard for me to get information from Department of Health. So they take that very, very seriously. So think about, the community at large and what we're trying to do as a community, and together we'll get through this.
Thank you. We're a minute away from an hour, so in closing, I just want to thank everyone. This has been such an insightful conversation. I think together we can indeed navigate the new normal with the right information, understanding, and by supporting each other. So we're counting on all of us to really do our part in keeping our kupunas and just our community people in safe. So thank you all so much for joining us today, and please come back to the Palolo Chinese Home website for more takeaways from our discussion. If this has been helpful for you, we hope you'll join us at our next webinar, and our guest speaker will be Geriatrics. That's on Saturday, October 24th at 10 a.m. And please stay tuned for more details. And also, please sign up on our website. We have our monthly Noodles newsletter, and that would probably provide you some updated information also. But on behalf of our panel, Dr. Yazawa, Mia Taylor, Isa Pobre, and myself, Darlene Nakayama, we want to wish you a really safe day today, and stay safe, and aloha and mahalo. Thank you.
Thank you.